Did you know that in Colombia, 7 out of 10 deaths are related to chronic disease? These silent diseases, such as diabetes, hypertension, and cancer, not only affect the health of millions of people, they are also changing the way we live, work, and care ourselves. Colombia, a country with diverse landscapes, vibrant cultural roots, and slowly aging population today face and of the great silent challenge to its healthcare system, the progressive increase in chronic non-communicable disease. These conditions, which include hypertension, diabetes, lung disease, and many others, not only affect the quality of life to those we suffer from them, but also place an increasing heavy burden of the healthcare system, especially in regions with less access to preventive service. What, what factors are behind this phenomenon? Today we'll tell you what's happening with chronic disease in Colombia and how they impact our lives as society. In a recent study conducted with 2062 patients, the behavior and distributions of the most common chronic disease in Colombia was analyzed. The results are overwhelming. More than 60% of diagnostics are related to primary essential hypertension and conditions that can be prevented with good lifestyle habits, but which today remains the most common enemy. In second place is not insulin dependent diabetes mellitus, with a percent close to 10%. This is followed by hypothyroidism, chronic obstructive pulmonary disease, and unspecific obesity. The conditions are strongly related to only lifestyles, unbalanced diets, and lack for physical activity. Which gender suffers the most from cardiovascular disease? Women, a higher proportion of cases, especially in cardiovascular conditions such as primary essential hypertension, which tops the list of diagnoses. This trend can be explained by women's longer life expectancies, which expose them to risk factors for longer as well as behavior greater. Frequency of seeking medical care, which leads to more consistent detection of these pathologies. And now we will discuss the body mass index. How does excess weight reflect in BMA influence the onset and consequence of chronic disease, such as hypertension and diabetes in patient analysis? Its clear relationship with the presence of chronic disease in the patient analysis of the most them are within or overweight and obesity type 1 range, which coincides with the high prevalence of diagnosed such as primarily essential hypertension, type 2 diabetes, and dyslipidemias. Distribution suggests that excess body weight is a determining risk factor in the development of these pathologies. Furthermore, it's observed that is BME increase. So does clinical complications of the patients, as many have multiple associated chronic disease. In this case, we can visualize because the EMC is peso normal, sobrepeso, obesidad. And age is also a determining factor. And what age do these diseases the most commonly occur? Chronic disease primarily affect older adults, and the analysis shows that most affect age groups are those between 78 and 91 years. The these age have the highest concentration of diagnosis, which shows that aging is closely related to increase in the prevalence of disease such as hypertension, diabetes, and lung disease. In the University of Patients analyzed the vast majority do not have do not present disabilities. However, disabilities have a significant influence on the development and management of chronic disease. In the analysis conducted along, the majority of patients don't have disabilities among those who do physical, mental, and sensory motor disabilities predominant. In this moment, we can visualize the no present in physical and motor, see physical and sensorial disability is more common, but not is a factor with affect chronic disease. Behind every diagnosis is a story. A woman struggling to control her blood pressure. An older adult who cannot afford their medications as community waiting for a health bridge. Chronic disease are a reality that Colombia must address with preventive policies, continuing education, equality access, and human care. Because health cannot wait. Thank you for your attention. My name is Carol Gutierrez, and this is a top 10 for chronic disease. Thank you.